The leaders of Colorado's rural hospitals want more answers from the state after they got blindsided with a funding loss recently. So the state is demanding $60 million back from critical access and safety net hospitals in order to pay out a legal agreement with UC Health.
Being exposed to some data last week that purported that I might have $1 million payback was sort of out of left field and didn't make 100% sense to me.
Jason Amrich there is the CEO of Gunnison Valley Health. It's one of 28 rural hospitals that got a nasty surprise late last month. The state wants to claw back between $600,000 up to $4 million from each of these hospitals, and they want a whopping $15 million from Denver Health. The state says it needs those funds to pay UC Health. A court ruled that the state misclassified and wrongly withheld funding from 2 UC Health locations. So Gunnison Valley Health is supposed to pay back $2 million. Melissa Memorial in Holyoke is on the hook for $1 million. CEOs for both those hospitals tell us it's not clear to them at this point when they are supposed to come up with this funding, how the state's going to do the math, decide who owes what. Their concern at this point is that lost funding could cause some rural hospitals to close or to cut back on services, and that would just add stress to other hospitals around the state.
I'm concerned about my hospital, my own hospital, certainly, but I'm also very concerned about the safety net around the state. And then, on a smaller scale, but no less important to the people of those communities, these smaller hospitals that have a big number next to them as well, or one that simply doesn't have the cash on hand.
We are all one health system, right? As a critical access level 4 trauma center, if I can't provide care, I transfer out to either a level 2 or a level 1, whether that's in Grand Junction or the Front Range or Colorado Springs. So we really are interconnected.
Both those hospital leaders tell us they have not been told how the state funding will change on a go-forward basis. They just want the opportunity to sit down with state regulators and the State Hospital Association to try and walk through whether they might come up with a different payback option as they face these clawbacks.